Okay, hi, I'm Danielle. This is Brad Fraser. I'll be taking him through an exercise screening process. Okay, hi Brad, nice to meet you.
Hi Danielle.
Great. Okay, I'm basically going to be taking you through a pre-exercise screening tool, which basically gives me an indication of your background and if you have any contraindications, which basically refers to any illnesses or any strains or injuries that are laying dormant that I need to know about. So at any time, if you don't feel comfortable during this process, we can stop it at your request.
Okay.
Are you happy to continue?
Yes, I am.
Okay. So this screen tool does not provide advice on a particular matter, nor does it substitute for advice from an appropriate qualified medical professional. No warranty of safety and should result from its use. The screening system is no way guarantees against injury or death. No responsibility or liability whatsoever can be accepted by Exercise Sports Science Australia, Fitness Australia, or Sports Medicine Australia for any loss, damage or injury that may arise from any person acting on any statement or information contained in this tool. Okay, are you still happy to continue?
Yes, I am.
Okay, so what is your name?
My name's Bradley Fraser.
And what is your date of birth?
14th of the 1st, 1973.
So male and the aim of this pre-screening tool is to identify those individuals with a known disease or signs or symptoms of disease who may be at a higher risk of an adverse event during physical activity. This stage is self-administered and self-evaluated. Basically, I'm the exercise consultant and I'll be taking you through it. And yeah, are you still happy to participate in it?
Yes, I am. Yeah.
Okay. Has your doctor ever told you that you have a heart condition or have you ever suffered a stroke?
No, I haven't.
No. Do you ever experience unexplained pains in your chest or at rest during physical activity?
No.
Do you ever feel faint or have spells of dizziness during physical activity or exercise that could enable you to lose balance?
No.
Have you had an asthma attack requiring immediate medical attention in the last 12 months?
No.
Do you have diabetes type 1 or 2?
No.
No. Do you have any diagnosed muscle or bone joint problems?
Luckily not.
No. Okay, so do you have any other medical conditions that may make it dangerous for you to participate in physical activity?
No.
Okay, great, Badly. So seeing that you've answered no to all of these 7 questions, that means that you're at a low risk. That means we can continue on to stage 2. Okay, so can you sign over here, please?
Sure.
Great. Okay, so Bradley. Fraser. Yeah, the 14th. First, 73. So you're still quite comfortable with this?
Yeah.
Okay. Okay, so your age is
45.
45. Gender male. Okay, so you don't have a risk factor here because of your age. If you were 45 years and over, there would be a 1 risk factor. Okay, do you have a family history of heart disease, stroke, heart attacks in your mum's side or your dad's side?
We have had my grandfather had a stroke and a heart attack, I think. Yeah.
Oh yeah. Okay, so that's grandfather.
He was at a pretty advanced age though. Yeah.
Okay. So about
74.
oh,
Yeah.
good age. Okay, so do you smoke cigarettes on a daily basis?
No.
Describe your current physical activity levels.
Not very much at all. Yeah.
Okay, so sedentary or light?
Yeah, sedentary.
Okay, so that puts you in the 1 risk factor category. Okay, please state your height, which is 5'11", and your weight was 100 kg. So with our earlier test of our fitness appraisal, we basically come to a BMI of 30.9. Yeah. So that gives you basically 1 risk factor. Have you ever been told that you have high blood pressure?
No, I haven't.
Have you ever been told that you have high cholesterol?
No.
Have you ever been told that you have high sugar?
No.
Okay. So we have like 2 risk factors on the side. Have you ever spent time in hospital, including day admission, for any medical conditions, illnesses, injury in the last 12 months?
No.
Are you currently taking a prescribed medication for any conditions?
No.
Are you pregnant or have you given birth? Obviously not in the last 12 months.
No.
Do you have any other muscle, bone or joint pain or soreness that might be made worse by any particular types of physical activity?
No, I don't. No.
Okay, so we have basically got a risk factor of 2, and then that basically brings us over here to our exercise intensity guidelines. Okay, so here you are. You're sedentary. Okay, so that basically means that you can start at a heart rate max of 40%, which is at a rate of perceived exertion of 1 or under. Yeah, so basically this is just a guideline, a safe guideline for new participants to exercise to start at, and after that, maybe after about 6 weeks, they can gradually build up to maybe light or moderate, where there'll be an increase in heart rate measures. You could maybe exercise in between 40 to 55% range in about 6 weeks' time when we readjust your program.
Okay.
Okay, are you happy with that, Bradley?
Yeah.
Okay, thank you.
At least to start. Yeah.
It is. Bye.